Yeah. Living with diabetes, the challenges are real, but understanding your body, how you truly feel, that's where we start with Leon Rock's Guiding Hand on the African American Diabetes Podcast. Understand, we're talking blood sugar and healthy eating too, sharing stories and finding strength, me and you, from lifestyle changes to medical advice. We're building a community that's more than just nice. African American Diabetes, it's more than just a name. It's a journey to wellness, breaking free from the plague.
Good morning, good afternoon, and good evening, depending on when you are watching or listening to this podcast. Hi, I'm Leon Rock, and this is the African American Diabetes Podcast.
Because, there is a difference. I want your audience to know this. There's a difference between the African American Diabetes Association and the American Diabetes Association. First of all, let's do the American Diabetes Association. They were founded in 1939. Leon, think about it. You got to think about your parents and grandparents. 1939.
Mm-hmm.
Wow.
Mm-hmm.
Racism reigned.
Yes, it did.
The ADA message and outreach was not culturally relevant or even accessible during segregation.
Correct.
And today continues to be challenged, even if they have black faces on their website. That's not a criticism, it's an observation.
Mm-hmm.
The donor and community concern of the American Diabetes Association, their value proposition and its ineffectiveness with type 1 and the black community, that cannot be ignored. The American Diabetes Association has a board focused on diabetes research, education, and advocacy. Yep. The American Diabetes Association is a valuable organization for diabetes research, education, and advocacy for many people. Let's not throw the baby out with the bathwater. But if we don't acknowledge the fact that with all that they do and all the money they raise and all the endorsements they have, black people are still living sicker and dying younger with diabetes.
You said it right. And by the way, that was the beginning of the African American Diabetes Association. Because we learned, and by the way, you have provided unimaginable resource to the African American Diabetes Association in your role. You have been amazing, to say the least. You have guided us and guided our citizen-driven board of 90% of the African American Diabetes Board of Directors is actually people that have been impacted, have lived experiences with diabetes. And so when you were speaking just a moment ago about the American Diabetes Association, and we celebrate them, but the bottom line is that from 1939, when segregation was alive and well, and we cannot, in many ways, fault them for establishing themselves in 1939. It was what it was. But we know that training of Black doctors around diabetes did not happen. It was segregation. That was the period in time. The fact of the matter is, outreach into the African American community didn't exist. So we had to go with folklore. And folklore said grandma had the sugar. Grandpa had the sugar. Auntie has the sugar. Oh, by the way, grandma and grandpa losing their leg, losing their extremities, losing a hand because of lack of control of diabetes. 39, 49, 59, 69, and beyond. So we had to create this institution called the African American Diabetes Association, just like you made a commitment way back when. Now that we're learning about this, your commitment, and I salute you for your commitment way back when in Pittsburgh, when you had an idea whose time had come to address health disparities in community in friendly places, barbershops, beauty salons. Come on, my good brother. And I'm going to call you my good brother. I'm not disrespecting your doctorate degree because you know I call you Dr. T. Dr. T, you have been amazing. Let me ask a quick question, though. You have brought a whole bunch of partners to the table. And some of the partners are obviously barbershops and beauty salons. But uniquely so, you know, I'm from Boston, Massachusetts, and in that area of New England, there's another group that you're working with. Talk about that relationship you have with that other group in Rhode Island, I believe.
You know, it's interesting coming off of the pandemic and our success and the visibility. If you go back just a little bit during the AIDS
Hmm.
pandemic, there
Hmm.
was another institution in the Black community that was lifted up, and that was a church. The
Yes.
Black church really got elevated as a
Hmm.
place to address the concerns, the anxieties, the ethical issues in HIV.
Hmm.
And today, no one would think twice about a health fair or an event taking place in a Black church. It's like standard of practice. Okay.
Correct.
But who would have imagined that the barbershops during the COVID pandemic would
Mhm.
arise as another sacred space? There's the difference. Most churches are nonprofits, charity,
Hmm.
tithes,
Hmm.
but barbershops are private businesses. These are our small business entrepreneurs. So we need to treat them that way.
Hmm.
Treat them as businesses. So whatever we do in this space should elevate their business. And during the pandemic, that happened. Barbershops that had good COVID mitigation, that
Hmm.
had good sanitation, where you could go and get a mask if you needed one, they became a resource. And I think that that's now not uncommon. It's not an anomaly. But we're at a moment now where even talking about COVID is on the ban list,
Mm.
on the bad word list.
Isn't that something?
Mis and disinformation on the bad word list.
Hmm.
So I think that I'm gonna back up just a moment. Again, the signposts. After President Bill Clinton apologized
Hmm.
to survivors of the syphilis study done at Tuskegee, there was um, congressional hearings were held right after the study was exposed in the newspapers in 1972. On that day, on the front pages of the newspapers, this horrendous study was on the front pages, and the study was literally still going on.
Hmm.
It wasn't the medical profession that broke the story, it was reporters. And the only reason I say that is that the congressional hearings that took place resulted in a major report. It's called the Belmont Report.
Hmm.
And the Belmont Report outlines the ethical principles for research, regardless of color. The first principle is do no harm, beneficence. If you have people involved in research, you must not harm them.
Hmm.
They must know the risk and the benefits. The next principle is autonomy. You have to get their permission. You can't experiment on people without their permission. So you have to have good informed consent. The third principle, justice. Now I'm saying to you, Leon, that that's the moment we're in right now to elevate the principle of justice. And that means those who carry the burden of disease must not be denied the benefit of the scientific solution. You can't go into parts of South America or poor neighborhoods in Appalachia or down south and do studies on people and come up with a blockbuster drug that saves lives, but the very people who you experimented on have no access to it, can't afford it. Justice means that we need to do all we can for fairness. And I think that's the moment we're in right now in our collaboration with you, the African American Diabetes Association, the HAIR Network, the University of Maryland School of Public Health Center for Health Equity. And it's in that context and that visibility coming out of the pandemic that the Centers for Disease Control reached out and responded to a proposal that was submitted by ProChange Behavior Solutions, right out of Providence, Rhode Island.
Mhm.
They're an amazing organization. They use a theory-based approach to help people change their behavior. And they literally put it right in your hands on your phone, Leon. Just right there
Wow.
with the text base.
Come on now.
So our first initiative was called Cut for Health.
Uh-huh.
We were focused on identifying people who had prediabetes. Prediabetes. And a lot of people didn't even know what that was. And one of the things that we learned is that when people went to their health professional and talked about prediabetes, some of those health professionals didn't agree that such a thing even existed.
Right.
Now, what does that tell you? Here we are sending our people, educating them in the barbershops, sending them now along the path to get their health care. And they get in the door of the healthcare provider and told, well, I don't think there is such a thing as prediabetes. We finally educate them about the importance of getting a colonoscopy. They finally get to their primary, they talk about, I need a colonoscopy, and the doctor says, well, you're not age 50 yet. Wow. I told the CDC and ProChange, we can't overcome that kind of pushback from the medical side.
Right.
Okay, now let's fast forward. The CDC says, look, nobody has ever done this. We said, listen, let's focus on people who have diabetes because they know they have it. And we got too many Black folks losing fingers, toes, going blind, amputations. And so the CDC says, let's do it. And that's the project we're in right now. It's called Cut to MD. Communities United to Manage Diabetes. And we have a whole network of Black barbershops and salons in the city of Baltimore that have recruited, Leon, you ready for this? Over 146 people enrolled in the program, 9 months. And oh, I want to make sure you roll the Cut to MD TikTok. That's the other thing we learned. We had to get on social media. We had to do TikToks, and you can go ahead. You want to run that right now?
I'm running it right now. Listen in, folks.
Hey, Baltimore, ready to take charge of your health and have a chance to win up to $100 every week? Introducing Cut to MD. We're partnering with barbers and stylists in our community to make managing diabetes easier and rewarding. Join the program, get support to manage your diabetes, and you could win up to $100 every week. Because we believe health is wealth. But hurry, spots are limited and will fill up fast. Join Cut to MD today.
Fantastic. How about that, Dr. P?
Well, that was Katrina Randolph. You know what they call her? The short-haired queen.
Come on now. So amazing.
So we are right now in the last push to complete our recruitment for Cut to MD. And we'll post links here in this podcast for people to learn more.
There they are.
And I want to tell you right now, Leon, you know, these grants have cycles. They have a beginning, a middle, and an end. But we are not stopping. And we're in a moment right now where we're seeing that if you say, I want to do a project that's focused on Black people, it may get pushed back. It may get pushed back on the bad word list.
On the bad word list.
We got to fight
Black
back on
American.
that. Okay?
Yeah.
On the bad word list.
Minority, women, all on the bad. Equity, inclusion. Who would think? Who would imagine? What are we going through in this country where equity and inclusion are bad words. And by the way, you wrote a poem about that, didn't you?
You know, Leon, I'm gonna tell you, when the bad word list came out, I couldn't believe it. And I was wondering, wow, our NIH grants all have these bad words in them, so-called.
Mm,
Ours, Cut the MD, has the bad words in them. What's going to happen? So, in addition to the titles you gave me and the introduction as a
mhm,
director of the Maryland Center for Health Equity and a professor in our Department of Health Policy and Management, I also had an NIH grant specifically embedding me inside the NIH as senior advisor for community engagement at the National Institutes on Drug Abuse to work with them on ensuring that our communities had access to opioid reversal agents, Narcan. So
yeah.
when we did our health fairs and our outreach for COVID, we had the National Institutes of Drug Abuse right there with us doing trainings on use of Narcan, distributing Narcan. And we even distributed test kits so that you could test your drugs to make sure they were not contaminated. Because some people think they're getting an Adderall or something that may be a pharmaceutical, not theirs, but they're getting it on the street, but it's been cut. This would let them know what it was. That was a big leap for the NIH, National Institutes on Drug Abuse, even to allow us to use test kits. We call it harm reduction. Harm reduction. And Leon, it was working.
Yes.
And I can't tell you the exact date. I'd have to go back and look. When I got the letter, I
Mm,
got the hammer,
mm.
and it's telling me that my intergovernmental personnel agreement, the IPA, that's what they call it, was terminated, quote unquote, at the convenience of the government. No rationale, no justification, no wind down, immediate.
Right.
Immediate. Now,
Mm.
I'm not going to say this is cause and effect, but it was just 2, 3 months after that that all those people fell
In
out
Baltimore.
in Baltimore
Exactly.
on,
Yep.
I mean, it was front page news all over
Yes.
New York Times, everywhere.
15,
On
20 people.
Pennsylvania, on Pennsylvania, luckily no one died,
Exactly.
but they literally,
Yeah.
and this is what they're going to pull my award when this is
Yes.
happening right on the streets.
Yes.
So I'm saying that, not backing down. And I wrote that poem in my own effort to direct my frustration
Hmm.
into something other than just anger.
Right.
You know how easy it could be to be an angry black man, Leon?
Oh, very easy. Yeah, listen, very easy based on our life experiences.
So I think we need to use all of the tools in the toolbox, including the arts and the humanities.
Hmm.
This is a time when books are written. This is a time when plays are written about the moment we're in. And I did I have no experience whatsoever,
Hmm.
but I would say this to you, my brother Leon. If I would be so honored if the time ever comes, if the time ever comes that you would so humbly read that poem. Because you know what, Leon? You got one of the best podcast
I
voices
did.
I've ever heard.
Well, I thank you very much, and I humbly thank you. And that would be an amazing opportunity. And guess what? The time has come because at the end of this podcast, I am actually going to read your poem as a closing commentary about what we believe are the challenges for today. Those words. Because
They
words make a difference, don't they?
words matter. They convey meaning. And so to change the words, to sanitize the language,
Hmm,
we need to be very conscious of what that means long term. There's a lot of blood, sweat, and suffering
that's right.
that allowed the health disparity research even to exist.
Right.
The National Institute of Minority Health and Health Disparities at the
Hmm,
National Institute has been eliminated.
eliminated.
And
That's
the founding director of that institute
hmm
Dr. John Ruffin.
Mm-hmm.
He's still alive and well. He's retired. Can you imagine what he is seeing?
Yeah.
And so that's why it's so important when we talk about the creation of the African American Diabetes Association. I'm going to turn the tables on you a little bit, my brother, because I think what you've done is just so amazing that you formed the African American Diabetes Association as as a legacy, reflecting on the success of something else that came out of Tuskegee, Alabama.
Well,
The night.
listen, yeah, I gotta say this, and I know what you're going to talk about, but I have to qualify what you're going to say. When I say qualify, I want to humbly um, let you know our appreciation at the African American Diabetes Association. You met with the whole board of directors, and actually, you explained to us what we are doing in relationship to a phenomenal group of people led by an amazing giant that you're going to talk about. All I wanted to say before you talk about it is how much the African American Diabetes Association Board of Directors and Executive Committee appreciate you for giving us a better understanding of the importance of our work and the legacy that we plan to reestablish, because the chain was broken. But you, my dear brother, Dr. T, made us understand how to connect those chains back. Thank you, Dr. T. And now, go ahead, Dr. T. You can explain it better than I.
You know, you did a wonderful job in that preamble because sometimes, you need to recognize that these solutions our ancestors left for us they've always been here, but it was not in my formal training as a public health professional that I even learned about what I'm about to tell you, your
Mhm,
audience, and what I shared with your board.
mhm,
And I'm saying we're now going to have to pull out every tool in our toolbox. So think about this. You were at our event during the midst of the pandemic
mhm,
in February.
mhm,
Okay. On I'm out there in talking to the folk in the barbershop about the importance of herd immunity.
mhm,
Herd immunity.
mhm,
And Dynamite Brown says to me, Dr. T, when you get a nickname, you know you're in, right? Dr. T, you're talking about herd immunity. It's Black History Month. Have you looked at the TV lately? Every time you see a little documentary, we are in slavery. We're a chattel slave. We're in chains. What are
mhm,
you talking about herd immunity? We're not animals. And he was right. And I tried to explain, well, herd immunity is, you have to inoculate one and get the whole it comes out of animal husbandry.
right.
I get it. I get it.
Mhm,
And Dynamite Brown's listening to me. And then he translates it. And he
mhm.
says, well, Dr. T, that sounds like community immunity. And I said, you know what? That works too. When it comes to humans,
Uh-huh.
let's say community immunity, not herd
Word.
immunity, please.
Yes.
And my point in sharing that with you is the wisdom coming out of the Black barbershops and beauty salons about how to talk to people,
Mm,
how to meet them where they are, how to not make them feel ignorant if you know a little bit more than they do. And so I thought it was just so important for your board and now your audience here to know that ADA, in many ways, is echoing our success of the past. And that is what was called at the time National. Actually, Booker T first called it Negro Health Improvement Week. It was just a week.
Hmm.
And this was at a time when people were also dying from infectious diseases. It had to do with issues around sanitation and
Hmm. Hmm.
mosquito control and having good privies. And white folks had modern public health at the time in their communities, but they neglected the black side of town.
Right.
And Booker T, who was an entrepreneur,
Mm.
recognized that if you're dying prematurely from these infectious diseases, you're not going to be able to pass on wealth to your family.
That's right.
And so he did something quite amazing because you had a lot of people at that time who were rural who could not read, but they knew the rhythm of the church and the rhythm of the black church revival.
Hmm.
And Booker T took that muscle memory, that emotional memory, and created something quite amazing, Negro Health Improvement Week, that ultimately became the National Negro Health Movement that took place from 1915 to 1951. And anyone out there in your listening audience who's never heard of that,
Hmm.
wow, that just says something about our education system. So that's how Booker T addressed the pain and suffering of his moment. And from where I'm sitting, as I shared with your board, you were born of the pain of being forgotten by a majority of the healthcare organizations, just as Booker T was.
Hmm.
But it's not infectious disease and mosquitoes, it's type 2 diabetes.
Correct.
The African American Diabetes Association focuses on Black communities' need for culturally relevant education. You don't shy away from that.
That's
That's
right.
why if you didn't need it to be Black, just go with the
Hmm.
ADA.
That's right. Exactly.
And if they thought being Black was just hiring somebody Black, they
Hmm.
missed the point.
Yes.
And then I shared you know, community engagement and advocacy projects give people something to do.
Right.
People need something to do
We
and
agree.
not just scream at the suffering.
Hmm.
So legal segregation ended in 1960s, but its legacy continues to impact healthcare access and outcomes for Black communities today. And almost it's it's frightening to think that we'd be going backwards, Brother Leon. And that's why this history is now even more relevant. And so you and I have been working on raising the resources needed to literally launch the contemporary version of the Negro Health Improvement Week. We may come up with a different name. I think now I'm back to Pittsburgh. The Healthy Black Family Project was an
Yes.
effort to do just that. We'll come up with whatever we have to come up with. But if a bad word's in the name, Leon, Black, we
Hmm.
ain't going back. They're forcing us to have to do
Come
that.
on. Yes.
So I just want to thank you for embracing that history of Booker T. Washington and Negro Health Improvement Week. And maybe we can share with your audience some of what that looks like and our efforts to bring that to a national audience. And maybe before we're done, you can say just a little bit about grace.
Yes.
Just a
Yes.
little bit
Yes.
about grace.
Yes, actually, GRACE is an important project of the African American Diabetes Association. And actually, you, my dear friend, came up with the naming of this uh, project based on conversations that you were having with our board as we were coming up with some strategies and plans and approaches. And you said, my goodness. This is an opportunity to create a grassroots effort to educate people around diabetes and other comorbidities. And we were like, what is a comorbidity? And you broke it down just like the expert that you are in little bites for us to understand. Because remember, the board of directors are grassroots folks, people in neighborhoods and communities that have been impacted by diabetes. And you were bringing it down to a level that we could understand, and we appreciate your ability to talk with us at that level. I know that you're academic and you know from time to time you talk to the biggest groups across the country addressing diabetes and other comorbidities, cardiovascular diseases, so forth and so on. But you were able to walk the walk and talk the talk with us to begin to come up with special projects and special programs. We celebrate you, by the way, for the work that you do. I've been at your graduation of the Bobbers and they are amazing. Every time I'm in your company, and I gotta tell you, I'm gonna get back to Grace in a second, but I gotta tell one other part of our relationship. When you were mentioning that the government made a decision, although I wasn't there when they made the decision and you walked into that building to be told what you were told, it was the same day that I was with you at, yeah, a amazing building in your offices in the middle of some of the toughest neighborhoods in Baltimore, Maryland. And, the Thurgood Marshall Center. And how appropriate was it that we were meeting at that time, convening people from all walks of life to come up with strategies and plans and approaches to address health disparities. All I can do is say, my brother, I salute you. And by the way, if you don't mind, while I'm going to talk about Grace, I'd like you to talk about your relationship with that amazing center in the middle of some of the toughest neighborhoods in Baltimore, Maryland.
Leon, I think that we could not have better timing than we have right now. And when your audience hears you describe Grace, grassroots action for community empowerment, Grace, wow. I'm just honored to be part of launching this initiative with you and helping our people know, hey, this is a legacy from our march to freedom from slavery. It's a continuation. And so it is also a continuation to recognize that what's happening right now in this country, this rollback,
Yes.
it's rolling back a whole lot, brother. It's
Yes.
rolling back the civil rights movement. It's rolling back all the sacrifice of Dr. King and everyone associated with that movement. They're rolling it back.
Say it.
Okay? So
Yep.
it's significant that for Cut to MD, Communities United to Manage Diabetes, we made the city of Baltimore our priority, and not just any part of Baltimore, West Baltimore.
Right.
We are on Division Street, and on that street is the school that Thurgood Marshall went to. And what's interesting, and this could be another show in and of itself. We could bring some of the visionaries, Judge Alex Williams and Reverend Hathaway, to talk about how they walked down that street in Baltimore, characterized by boarded up row houses, a beautiful building that was a school that had burned, roof fallen in, birds flying around inside. How they looked at that and imagine what it could be. They had an idea that is now, you ready for this? A cathedral. It's a cathedral of learning. They brought that building back to life. It's now the Thurgood Marshall Amenity Center. Amenity means putting back what was taken out.
Mm.
That was the school that produced a Thurgood Marshall. It can do it again.
Yes.
And so we are committed to being in the neighborhoods where people live, to build those relationships.
Mm-hmm.
And I can't wait for the announcement of the Grace movement to be done right there on the steps of the Thurgood Marshall Amenity Center,
That's
because
right.
issues around economics,
Mm.
socioeconomics, and
Mm.
biology are all part of what Grace is
That's
going to
right.
address.
Yes. Grace. And I love it. Grassroots action for community empowerment. Grace. Essentially, an initiative, a project, a project of community empowerment, of advocacy, of addressing cardiometabolic conditions that are impacting our community. And by the way, I just used the word cardiometabolic. And by that, Doc, can you explain to the people out there what cardiometabolic means for us, for our community?
The fact of the matter is, and it's one of the things that we learned, is that our people don't just have one thing.
Mm-hmm.
They come with everything.
Right.
They got type 2 diabetes.
Mm-hmm.
They may have risk factors for cancer.
Mm-hmm.
Uh, Obviously, the leading cause of death is heart disease. But Brother Leon, we know now more than we've ever known about how these things all fit together in one human body. We now need to bring we're fragmented into organ systems. I got to
Mm-hmm.
go to the cardiologist for my heart. I got to
Mm-hmm.
go to the endocrinologist for my pancreas and my diabetes. I got to go to the gastroenterologist. Somehow we have to bring the body back together so that people understand it's all connected. So if we zoom in on cardiometabolic disease, we're talking about a group of closely linked conditions, including heart disease, stroke, high blood pressure, obesity, and type 2 diabetes. Those are all clustered
Wow.
together, Leon. And if the audience that we're talking to now are dealing with health professionals that aren't putting these things together,
Right.
you might need to shop or educate your health professional, and we can help you do that. These are among the leading causes of death and disability. There's a key word, disability.
Mm.
Get a stroke. Oh, it didn't kill you, but you're paralyzed. Disability.
Right.
These are the leading causes of death and disability in the United States,
Mm-hmm.
and they hit communities of color the hardest.
Mm.
Let me just give you just a few examples why cardiometabolic disease is a major health disparity. Let's take a look at Black and Latino adults. They get sicker earlier and more often. Now, here's an example. Let's take a 45-year-old Black man is more likely to have high blood pressure than a 65-year-old white man. And yet, he may be undiagnosed until he ends up in the ER with a stroke or a heart attack.
Right.
That's when our people find out, oh, I I have these risks. They find out in the ER.
Mm.
Here's another example. Healthy choices aren't always available. To address cardiometabolic risk factors, you got to adjust your lifestyle. We are living in a society where ultra processed foods are literally available 24/7.
Mm.
In many low income neighborhoods, there are fast food chains on every corner, but
That's right.
no full service grocery store. So it's easier and cheaper to get fried chicken than fresh spinach. That's not about personal failure. That's about limited options. And Leon, once you get that spinach and the artichokes and the eggplant, guess what? You need to know how to cook them.
That's right. Yes. Come
So
on.
we want people to do healthy choices, but we have to help them take the action. Here's number three, stress. Stress from racism affects the body. So chronic stress from discrimination literally raises your blood pressure, increases your blood sugar, and causes weight gain. Weight gain.
Right.
This is what we call weathering.
Mm.
Weathering. It helps explain why even middle class Black people have worse heart health than their white peers. Now, this weathering idea is something, Leon, because Black people have to tell their kids the talk. They have to talk with their kids about you are Black. When you go out here,
That's
you're going to
right.
be treated as Black
Yeah.
because at 50 paces, they're going to a Black person's coming my way.
Right.
And over time, that kind of stress of constantly being hyper vigilant, constantly
Mhm.
wondering if
Mhm.
was I just slighted there because of my color? Was that what was that? Leads to a hyper vigilance. And so you have to think about it like this. If you are sitting in your driveway, you turn the car on, it's in neutral, and you press the gas pedal all the way down.
Mhm.
At some point you hear that engine and you say, I don't want to burn my engine out. I better back off the pedal, right?
Right.
That's what chronic stress is.
Mm.
People are not backing off the pedal until they're in the ER.
Right.
And so I'm going to tell you something very interesting about the collaboration that we had with the National Institutes on Drug Abuse and the work we did in the HAIR network.
Mm-hmm.
We actually conducted a study
Mm-hmm.
to measure stress hormones,
Mm.
cortisol,
Mm.
and fentanyl. Ready for this? In the hair. Your
Wow.
hair is like a tree. You cut a tree down and you look at the rings, you could tell the whole history of that tree. Okay?
Mm-hmm. Mm-hmm.
We had a IRB, Institutional Review Board,
Mm-hmm.
protocol approved by the
Mm-hmm.
University of Maryland. We did informed consent.
Right.
We trained the barbers in collecting the hair samples.
Mm-hmm.
We collected them in the barbershop.
Mm-hmm.
We stored them in a scientifically valid way and shipped them to the laboratories of the National Institutes of Health, the Bayview Labs in Baltimore. And we had preliminary results, Leon. We
Wow.
were able to pick up a signal
Uh-huh.
of cortisol in the hair,
Mm. Mm.
stress hormone, and we picked up a signal
Yeah.
of fentanyl in the hair.
Isn't that something? Wow.
That manuscript is on hold because convenience of the government.
Isn't that something?
They stopped us from
Wow.
publishing our work. But here's the other thing I want this audience to know in terms of the health equity approach.
Mm-hmm.
Our scientists from the National Institutes of Health came out to the barbershops, met the barbers, did the Narcan training, did screenings. We collected the hair samples. We did the analysis in the laboratory. But here's the other thing, Leon. We invited the barbers and the stylists to the Bayview Labs in Baltimore.
Wow.
They could literally walk into that building
Uh-huh.
and into the laboratories where the scientists were there with all their beakers and all their scientific equipment.
Right. Right.
And they're talking to the barbers right there.
Wow.
All of a sudden,
Mm-hmm.
the gap melted away.
Wow.
And you know what else is interesting, Leon? When we walked into that building, one of the barbers said, I built this building. I thought he was playing. No, he was a construction worker when the place was built.
Come
And he remembered, he said, I built this building. So think about it.
on. Mm-hmm.
You got the construction workers who build the building.
Mm-hmm.
Now the building's built
Right.
and they're locked out,
Isn't that
real or metaphorically locked out, not
Mhm.
feeling welcome to even come in there. And then they return and they realize, I built it. I belong here. I built this. And that's the gap we closed right before they terminated the partnership.
Wow.
Come on now. We
Ugh.
need to make sure
my
that those are our tax dollars
That's right.
building this science. No research on us without us. And that's why moving forward, Leon, we're going to take this message beyond just the typical traditional government agencies at the NIH, CDC, Centers for Disease Control and Prevention, National Science Foundation. I think we have to revisit our relationship with the pharmaceutical industry.
Mm-hmm.
At the end of the day, they're still producing medications.
Mm-hmm.
At the end of the day, they're still doing clinical trials to find cures for disease. And at the end of the day, I would hope and I expect that they want their products to be beneficial and useful to everybody.
That's right.
Everybody. So I think we take grace to them, that we take grace to whoever is interested in fairness,
That's right.
whoever is interested in ensuring that justice, bioethics principle of justice, those who bear the burden should not be denied the benefit. Those who suffer from the disease should not be denied the benefit of the cure. That is a legacy of our ancestors.
That's
Let me
right.
say one more thing, Leon. During the pandemic,
Hmm.
there was a ad council advertisement
Hmm.
because of this issue of mis and disinformation, and because the syphilis study done at Tuskegee was being used to say, oh, that's why Black people aren't getting vaccinated. They're
Hmm.
still hung up and mad about Tuskegee. But the reality was they were not bringing the vaccines into our community.
That's right.
And then use that history
That's
as
right. Yeah.
blaming us.
Yeah.
Can you
Right.
believe that?
Right. As usual. Let me ask you one other thing, and I know you have to go. You've spent so much quality time giving us so much information to be able to hear and observe and kind of in many ways dissect and make real in our communities, no matter where you're listening from. But there's one thing that there's a gap that I want to talk about, and that is, and you've mentioned it a number of times, and that is research. 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 There are people that come into the African American community over so many years researching us and not sharing the information that has been provided in relationship to the research. And by the way, I salute those organizations that do research. And by the way, I do recommend that people in the African American community be involved in research and studies. No question and no doubt. But is there a time in which Black folks can begin to control our own research? And is there a thinking that you have about research and research models moving forward? Is there any groundbreaking effort, wink, wink, that you know about that you may be involved with in relationship to research moving forward? Because I guess the system of research, particularly around health and health equity, is being broken up by the United States government. Should African Americans and others that are concerned about research begin to develop research models? And how are you doing with that?
Well, Leon, you know, as we come to this phase of the show, I think it is incumbent upon us to let your audience know that what's happening right now before our very eyes is the destruction of our entire biomedical research infrastructure. You can't turn it back on with the light switch of a light. Yes, there's lawsuits. Yes, there's things pending, but guess what? People have already lost their jobs.
Hmm,
Thousands and thousands of them.
hmm,
The experts. You don't turn it back on overnight. We now, just like back in the day with the National Medical Association, just like today with the African American Diabetes Association, I think that we need to plant our flag in this space of biomedical research. No research on us without us. That means we need to pick up the banner as well. And so I'm hoping I'll be invited back and we can bring some of the other partners with us to share with your audience what you and I are doing, along with collaborators. Nepenthe. Nepenthe is a Greek word that has to do with the elimination of human suffering. And in partnership with private physicians, here's what I like, Leon.
uh,
We got the University of Maryland Center
yes.
for Health Equity.
Hmm.
That's the research wing.
Yes.
We got the African American Diabetes Association. That's the citizen scientists.
That's
And we got the private practitioners represented by Dr. Carol Ritter with MD VIP. We're talking about bringing concierge VIP care
Hmm.
to the community.
Hmm.
All right. Not with students, nothing wrong with students getting training, but with seasoned professional physicians who close their offices to come out into the neighborhoods and provide us with that kind of medical oversight and screening that we need to do our own science. You hear me, Leon? Do our
Yes.
own science.
Come on.
And we're going to train these medical professionals in a program that we call HELP,
Mhm.
Health Equity Leadership Program.
Wow. Come on,
There's nothing
doctor.
stigmatizing about that.
Wow.
Y'all need help. Help is the Health Equity Leadership Program. We are not going to throw away our legacy to sanitize our language. So I hope we can come back, bring the wellness warriors, bring
Yes.
Dr. Ritter and the private physicians,
Yes, again.
talk about the launch of Negro Health Improvement Week, whatever we're going to, hey, it's going to be the launch of Grace.
That's right.
And in Grace, we're going to tell our people about the legacy that has brought us this far.
You, my dear friend, Dr. T, Dr. Stephen B. Thomas, we celebrate you. Thank you so very much. This, my dear friend, is a continued conversation. Thank you, Dr. T.
Make it a great day.
My goodness. Well, you've heard it all from Dr. T. And by the way, he's going to be back again and again and again. Thank you very much, Dr. T. This is a to be continued conversation. Thank you.
It's been an honor and a pleasure.
Thank you.
Yeah. Living with diabetes, the challenges are real, but understanding your body, how you truly feel, that's where we start with Leon Rock's Guiding Hand on the African American Diabetes Podcast. Understand, we're talking blood sugar and healthy eating too, sharing stories and finding strength, me and you, from lifestyle changes to medical advice. We're building a community that's more than just nice. African American Diabetes, it's more than just a name. It's a journey to wellness, breaking free from the plain.